Orthopedic surgery in general and hand surgery specifically have a lot of different procedures and different problems that could be fixed by different means, and there's a lot of cool toys that could be used, different instruments, and all kinds of different gadgets that are used to fix different problems. So some of the problems specifically in hands that could be affecting people are arthritis and trauma and different cuts of the soft tissues like tendons and ligaments. And there's different methods of fixing all of them. For fractures, you can use rods, you can use plates and screws, you can use little wires to fix things, and all of those things involve cool toys and different treatment methods that are interesting. And for cut tendons and things like that, we use mostly sutures to repair all of those things. And for arthritis, there's different things that could be done, including joint replacements, where you put a metal component on a bone, and it acts as your metal joint now instead of the existing arthritic joint. Yes, there are constant advancements that are made on yearly basis. There's usually something new that comes out. Not all of it eventually makes it to the full proven treatments regimen, but eventually some of these things do, and there is a lot of progress in general in orthopedics and in hand surgery specifically. So for thumb basal joint arthritis, one of the procedures that we do is interesting because we take out one of the bones at the base of the thumb and eventually leave empty space, or put a tendon or a half of a tendon that we take from the wrist. There's different tendons in the wrist, and one of them can be sacrificed, and it's put into the empty space that's remaining from that joint, from the bone that was removed. And people usually have significant relief in their symptoms. The arthritis pain goes away, the motion and the strength remain about the same. And so this is a very gratifying procedure to do for people with basal joint arthritis. There's other things like a trigger finger, where a tendon can get stuck in a pulley in a tight canal, and the tendon is too swollen, it doesn't fit through. And one of the things that could be done is, well, we start with non-operative treatments first with all of the orthopedic and hand surgery problems, and we do splinting and anti-inflammatory medications and bracing and steroid injections. But if nothing works, there is a procedure where the pulley can be cut and the tendon is free to glide within the canal without compression and without clicking. That provides significant relief for patients. Every time a patient comes into the office, we first go over the history and then look at the physical findings, and we look at x-rays, and then we make a treatment decision together. Once we diagnose the problem, we provide information to the patient and different educational materials about the problem. And once the patient knows more about the problem and the diagnosis, we go over different treatment options. And a lot of the time, most of the things could be solved without surgery. And different things that we use are anti-inflammatory medications and braces and steroid injections. And sometimes things are bad enough to offer an operation to the patient. And then we go over different benefits, risks, and alternatives to the surgery, and patient and I together make a decision about what's the best treatment to undertake.